Hi, today I want to talk about one of the myths that orthopedic surgeries are always necessary for certain injuries. So when you think about injuries, first of all, when we look at physical therapy, there are a lot of injuries and things that can be done that are very preventative, but also can help manage certain orthopedic conditions that don't require surgery. For example, knee pain. Knee pain can be your kneecap, cartilage issues there, cartilage issues with your meniscus in your knee, but there's also the hip and the ankle foot, and even sometimes the spine. So it's a physical therapist's job when they're doing that in the way we should, is we can look at that whole chain and really see where there's compensations and other joints that may be playing into your primary problem and now actually treating the whole person. So looking at your lifestyle, things that you're doing that may be contributing to your problem, and then now we come in and look at the big picture and are able to treat those things through exercise. We do a lot of manual physical therapy, which can involve, myofascial work, soft tissue, joint mobilization, spinal manipulation, dry needling, and a variety of other treatment approaches that we have. So there are many options to treatment before surgery, but do keep in mind that with a good consultation from your orthopedist as well as the PT, there are those circumstances after MRIs, diagnostic testing, and things have been done that there may be those times where clearly surgical intervention may be necessary, but that should typically be a last resort unless it's really determined that's really a direct need.